HSM 801, page 937, Evaluation of Health Programs and Services by Dr. I.D. Alabere, MNI. Outline, definitions, purpose of evaluation, models of evaluation, types of evaluation, process of evaluation, aspects of health services required in evaluation, conduct of evaluation. Definitions: the systematic examination and assessment of the features of an initiative and its effect in order to produce information that can be used by those who have an interest in its performance or its effectiveness. WHO 1998. The critical assessment on an objective basis the critical assessment on as objective a basis as possible of the degree to which entire services or their component parts fulfill stated goals. St. Leger et al. 1992. It is a measure of the effect of a program against the goals it set out to accomplish as a means of contributing to the subsequent decision making about the program and improving future program making. West 1972. It is essentially determining the extent to which certain goals have been achieved. Thorns 1998. Evaluation can be undertaken for a set of activities that have previously been planned. It is a systematic way of learning from experience and using the lessons learned to improve current activities and promote better planning by careful selection of alternatives for future action. It is therefore the process of collecting information to determine the relevance, adequacy, progress, efficiency, effectiveness, and impact of planned activities. Evaluation thus means assessing what is on ground to compare with what is expected. Purpose of evaluation. There are 4 purposes of evaluation. Generally, there are 4 purposes of evaluation. 1. Evaluation for accountability. 2. Evaluation for learning. 3. Evaluation for program management and development. 4. Evaluation as an ethical obligation. There are, however, several specific purposes of evaluation that fall under each of the 4 general purposes. It allows evidence-based decision-making that will lead to improvements in health programs and services. It enables the identification of workable and affordable interventions in the provision of services for healthcare needs of communities. It facilitates the detection of whether the benefits of health promotion actions are equitably distributed and reach those most in need. It assists in identifying those interventions that provide the greatest gains at the lowest cost. It serves as a guide for allocation of resources for current and future programs. It assists in detecting the successes, weaknesses, and failures in health programs and services. It enables careful assessment and critical appraisal of activities that will lead to drawing conclusions and assist in improving future actions. It provides a major role in protecting the public from inappropriate or harmful interventions. It assists in planning for healthcare provision. Models/approaches to evaluation. Scott 1998 identifies 7 models or approaches to evaluation which are contained in the table below. So you have evaluation model, then you have focus. Number 1, goal-oriented evaluation. Focus, effectiveness, efficiency, and economy of an intervention. 2, decision-oriented evaluation. Focus, improve decision-making. 3, evaluation research. Focus, providing explanations for outcomes. 4, responsive evaluation. Focus, process of evaluation and perspective of participants or stakeholders. 5, goal-free evaluation. Focus, openness to achievements other than those prescribed by the intervention's aims and objectives. The focus is on the actual outcomes, effects, rather than the intended outcomes of a program. 6, alternative explanations. Focus, alternatives to accepted descriptions about what is happening. 7, evaluation model, utilization-oriented evaluation. Focus, utility of findings to different stakeholders. So, Avedis Donabedian's 1998 model involves, so look at evaluation model and focus. 1, structure. Focus, the attributes of the setting in which the care occurs. This includes the attributes of material resources such as facilities, equipment, and power, of human resources such as number of and qualifications of personnel, and of organizational structure such as medical staff organization, methods of peer review, and methods of reimbursement. Evaluation model number 2, process. Focus, what is actually done in giving and receiving care. It includes the patient's activities in seeking care and carrying it out, as well as the practitioner's activities in making a diagnosis and recommending or implementing treatment, problems of recognition, interpersonal skills, bed occupancy, referral patterns, prescribing practice, admission procedures. Number 3, evaluation model, outcome. Focus, end results, measurable benefits experienced by those utilizing the health services, e.g., improved survival, reduce disability, effectiveness of activity or change in health status, mortality, morbidity, complication rate, quality of life. 5 Ds: disease, discomfort, dissatisfaction, disability, and death. Project development and evaluation. The primary focus of evaluation for any program or service or project will be on process, outcome, or both. However, as a general guide, a framework for any project evaluation, as suggested by the Health Education Board for Scotland (HEBS), categorized 4 stages of program development and corresponding type of evaluation required. The stages are 1. Planning, 2. Development, 3. Implementation, 4. Operation. So page 947, the HEBS framework for project evaluation. Stage of the project development, type of evaluation, purpose of evaluation. Stage of project development, you have planning, type of evaluation, systematic review, purpose of evaluation, overview of evidence of effectiveness from outcome evaluation. Stage of development of project development, design and pilot, type of evaluation, developmental evaluation, purpose of evaluation, to assess the feasibility, practicability, and acceptability of a project and its processes and mechanisms, to test the potential effectiveness of a new approach. Next stage of project development, implementation, early startup, type of evaluation, monitoring and review, purpose of evaluation, to monitor and review progress in achieving milestones and agreed standards. Stage of project development, implementation, establishment, type of evaluation, impact evaluation, purpose of evaluation, to assess the short-term effectiveness of a project in terms of its reach and its immediate impact. Stage of project development, implementation, fully operational, type of evaluation, outcome evaluation, purpose of evaluation, to assess the long-term effectiveness of a project using intermediate outcome measures. Stage of project development, dissemination, type of evaluation, transfer evaluation, purpose of evaluation, to assess the replicability of a project's mechanisms, processes, and outcomes. Stakeholders in evaluation. For any program or project or service for evaluation, there are several stakeholders with varied interests and expectations. 1. Funders, accountability and achieving value for money. 2. Managers, achieve targets. 3. Project workers, health outcomes. 4. Other practitioners working in similar fields. 5. Target population, addressing own perceived needs. 6. Policy makers, usefulness of outcomes. 7. Politicians, support ideological leanings. 8. Public health community, benefit to population groups. 9. Academicians, learning, teaching, adoption/adaptation for research. 10. Theoreticians, comparison with existing facts and evidence. Types of evaluation continued. So evaluation type definition uses example. So type 1, formative definition, evaluates a program during development in order to make early improvements. 2. It helps to refine or improve program. Okay, evaluates program. So use this rather for evaluating a program during development in order to make early improvements. Use when starting a new program. Example, how well is the program being delivered? Still under formative, the second definition helps to refine or improve program. Uses to assist in the early phases of program development. Example, what strategies can we use to improve this program? Evaluation type number 2, summative definition, provides information on program effectiveness. Uses to help decide whether to continue or end a program. Example, should this program be continue to be funded? Under summative, you still have the second definition, conducted after the completion of the program. Uses to help determine whether a program should be expanded to other locations. Example, should we expand these services to all other schools in the community? Another type of evaluation, process definition, determines if specific program strategies were implemented as planned. Uses to determine why an established program has changed over time. Example, did the program meet its goals for the recruitment of program participants? Still under process definition, focuses on program implementation. Uses to address inefficiencies in program delivery of services. Another use to accurately portray to outside parties program operations, e.g. for replication elsewhere. Example, did participants receive the specified number of service hours? Evaluation type, outcomes definition, focuses on the changes in comprehension, attitudes, and practices that result from program activities. It can include both short and long-term results. Uses to decide whether program/activity affected the participants or outcomes, to establish and measure clear benefits of the program. Example, did the participants report the desired changes after completing a program cycle? What are the short or long-term results observed by among or reported by participants? Evaluation type again, impact Definition focuses on long-term sustained changes as a result of the program activities, both positive/negative and intended or unintended. Uses to influence policy. Secondly, to see the impact in longitudinal studies with comparison groups. Example, what changes in the program participants' behavior are attributable to this program? What effects would program participants miss out without this program? Types of evaluation. Continued. Management audit. This is a method of reviewing management activities. It is a tool which health managers use to evaluate successes and weaknesses and failures to improve on future actions. Management audit focuses on all aspects of health services delivery system. Clinical audit. This is a systematic and critical analysis of the quality of patient care. Clinical audit is a way that doctors, nurses, and other healthcare professionals can measure the quality of the care they offer. It measures existing practice against evidence-based clinical standards. All clinical audit must comply to the clinical audit governance requirements. It thus allows them to compare their performance against a standard to see how they are doing and identify opportunities for improvement. Changes that can then be made, followed by further audits to see if these changes have been successful. It involves assessing the procedures employed in diagnosis, treatment, and outcome of care for the patients. The clinical audit process seeks to identify areas for service improvement, develop and carry out plans and actions to rectify or improve service provision, and then to re-audit to ensure that these changes have an effect. The audit also includes available equipment, process, that is investigations, waiting time, duration of stay in the hospital, mortality, morbidity. This is undertaken to 1. Safeguard the quality of clinical care. 2. Improve resource allocation. 3. Enhance clinical decision making. 4. Quality assurance in patient care. 5. Enhances medical education. Medical audit. In addition to all that is contained in clinical audits, medical audits considers the quality of food given to the patients, cleanliness of the hospital, power supply and lighting, patients and staff security, etc. Problems of wrong conclusion from evaluation research. Drawing conclusions from evaluation research could face serious problems where the conclusions are not based on sound evidence and judgment. The common problems which are considered errors since the attendant results or conclusions are deviations from reality are, you have type 1 to type 5 errors. So for the type 1 error, the wrong conclusion that an intervention has achieved significant change when it has actually failed to do so. Type 2 error, the wrong conclusion that an intervention has failed to have a significant effect when it actually has done so. Type 3 error, judging that an intervention has failed when it was so poorly designed that it could not have achieved the desired effect. Type 4 error, conducting an evaluation of a program that no one cares about and is irrelevant to decision making. Type 5 error, the intervention is shown to have a statistically significant effect, but the change is so small as to have no practical significance. Process of evaluation. The evaluation process for any health program or services has the following steps. Step 1, determine what is to be evaluated. For any program or service, there are different parts. There are inputs. These are inputs, outputs, outcomes, and impact. The whole or any component of these parts could be evaluated. One therefore has to decide what is to be evaluated. Inputs, resources, processes, that is activities, treatments, management engaged in purposefully, e.g. interventions in a health program, in the spontaneous operation of a system. Outputs, the immediate result of professional or institutional healthcare activities, usually expressed as units of services, e.g. outpatient visits, patient hospital days, and laboratory tests done. Outcome, these are all the possible results that come from a preventive or therapeutic intervention. It includes all identified changes arising from the handling of a health problem. Impact, the overall effect of the intervention, e.g. percentage reduction of morbidity and mortality. Number 2 step in process of evaluation, establish standards and criteria. This is required to determine how well the desired objectives have been achieved. Standards are natural prerequisites for any evaluation. Standards and criteria must be developed in accordance with the focus of evaluation. Structural criteria, e.g. facilities and equipment. Okay, so talking of criteria. 2. Process criteria, e.g. mandatory number of antenatal visits by pregnant women attending ANC before delivery. Expected number of blood films examined by laboratory scientists or number of prescriptions attended to by a pharmacist each day. Outcome criteria, e.g. alterations in patient's health status (cured, death, disability) or behavior resulting from healthcare (satisfaction, dissatisfaction). Step 3, process of evaluation, planning the methodology. This involves how to undertake the evaluation. A format in keeping with the purpose of evaluation must be prepared for gathering the desired information. Step 4, selection of indicators. Indicators to show what is to be achieved must be identified and selected, e.g., availability of adequate funds as an input indicator or number of antenatal visits as output indicator. So this enables the measurement of what is available or provided for comparison with the set standard. Step 5, observe performance and gather information. The performance of the health program, services, or health system needs to be observed and all necessary information obtained for analysis. The required information or data may be political, economic, cultural, environmental, and administrative factors that influence the health situation, including morbidity and mortality statistics. Step 6, analysis of results and comparison of performance against standards. The information or data obtained from the performance using the selected indicators is analyzed. The results are thereafter compared with the standards set. This is to determine whether the intended objectives were achieved, and if not, what could be done based on the observed performance. Step 7, feedback. This involves provision of information on the achievement of shortcomings of the entire process or a part of it to show those who planned or provided the service or implemented the program. Feedback is the communication that occurs among all parties to the evaluation. Giving and receiving feedback creates an atmosphere of trust among stakeholders. It keeps an evaluation on track by letting those involved stay informed regarding how the evaluation is proceeding. Obtaining feedback can be encouraged by holding periodic discussions during each step of the evaluation process and routinely sharing interim findings, provisional interpretations, and draft reports. Step 8, corrective actions. These are taken based on the performance and feedback. The corrective actions taken are designed to support, strengthen, or modify the services or program involved. Step 9, re-evaluation. This is done to determine if the corrective actions taken have resulted in the desired changes. Aspects of health services requiring evaluation. Relevance. This is done to determine the relevance of the program or service, that is, whether the program meets the needs of the people. Adequacy. This enables the assessment of the inputs into the program to determine if they were adequate or not, e.g., was there enough provision of ice packs, vaccines, manpower for the immunization exercise. Accessibility. This is the proportion of the given population that is expected to use a specified facility or service that eventually use it. Barriers to accessibility could be physical (distance, location, travel time), cultural (taboos, preferences), financial (travel costs, feeding costs, fees charged, opportunity cost). Acceptability. The services provided may not be acceptable even if they are accessible, e.g., vasectomy or tubal ligation for contraception. Progress. To examine the scheduled activities to see if they are going on well. What is on ground compared to the planned schedule. Aspects of health services required evaluation continued. Effectiveness. This is the extent to which the underlying problem is prevented or alleviated. It measures the degree of achievement of predetermined objectives and targets of the program. Service possibly in terms of health benefits, problem reduction, etc. The ultimate measure of effectiveness is the reduction of morbidity and mortality. Efficiency. This is a measure of how well resources, that is money, materials, manpower, and time, have been utilized to achieve a given effectiveness. It involves looking at the efforts compared with the results. Has health education of mothers resulted in reduction of infant diarrhea? Has there been unnecessary and avoidable wastage of resources? Resource inputs compared with results. Impact. This is an expression of the overall effect of the program, services, institution on health status and socio-economic development. What is the long-term effect of the program? Has there been a significant reduction in child mortality rates as a result of the special measles immunization program? Conduct of evaluation. You have evaluators. A program or service can be evaluated by any one of two groups of people. 1. Internal evaluation. This is self-evaluation in which people within a program sponsor, conduct, and control the evaluation. 2. External evaluation. In this case, someone or group of people who are outsiders, that is not involved in the program, act as the evaluator and controls the evaluation. Internal evaluation. Advantages. Knows the implementing organization, its programs and operations. 2. Understands and can interpret the behavior and attitudes of members of the organization. 3. May possess important information about the program or service. 4. Is known to staff and may therefore pose less threat of anxiety or disruption. 5. Can more easily accept and promote use of evaluation results. 6. Is often less costly. 7. Does not require time-consuming recruitment negotiations. 8. Contributes to strengthening national evaluation capabilities. Disadvantages of internal evaluation. 1. May lack objectivity and thus reduce credibility of findings. 2. Tends to accept the position of the organization. 3. Is usually too busy to participate fully. 4. Is part of the authority structure and may therefore be constrained by organization role conflict. 5. May not be sufficiently knowledgeable and experienced to design and implement an evaluation. 6. May not have special subject matter expertise. External evaluation. Advantages. 1. External evaluation. Advantages. 1. May be more objective and find it easier to formulate recommendations. 2. May be free from organizational bias. 3. May offer new perspectives and additional insights. 4. May have better evaluation skills and expertise in conducting an evaluation. 5. May be able to dedicate self full-time to the evaluation exercise. 6. Can serve as an arbitrator or facilitator between parties. 7. Can bring the organization into contact with additional technical resources. Disadvantages of external evaluation. 1. May not know the organization, its policies, procedures, and personalities. 2. May be ignorant of constraints affecting the feasibility of recommendations. 3. May be unfamiliar with the local political, cultural, and economic environment. 4. May tend to produce overly theoretical evaluation results if the evaluators come from a purely academic institution. 5. May be perceived as an adversary, arousing an unnecessary anxiety. 6. May be relatively costly. 7. Requires more time for contact, negotiation, orientation, and monitoring. Conclusion. Thanks. So this is the end of the slide. Page 967, references.